Assalamualaikum and a very good day to our lecturer of HSM 478, Sir Anurizal bin Anwar. Me and my group are going to present about Chapter 7, Wearable Healthcare Technology. Our selected medical device is called as glucose monitor. My name is Muhammad Adli Hakim bin Muhammad Rizal, and our group members consist of Amira Husna binti Maulud, Fatin Husna binti Rasfan, Ariana Syahrul Bahrin, and Nik Nur Nabila binti Nik Nur Hasni. According to Chapter 7, glucose monitor device falls under continual monitoring devices, which means it regularly checks the glucose levels, usually every few hours. It is especially for type 1 and type 2 diabetes patients who need to check their blood sugar levels consistently throughout the day. This device uses non-invasive optical sensors to detect the glucose levels through the skin. No need for finger pricks. The data is transmitted wirelessly to a smartphone app or a healthcare system device, allowing for a real-time monitoring, alerts and personalized care. The glucose monitor levels is a great example of how wearable technology can enhance chronic disease management, support telemedicine and reduce emergency risks, as well as detecting abnormal glucose levels early.
Okay, next for glucose monitor patch. How does it work? Okay, a continuous glucose monitor works through a tiny sensor inserted under our skin. Usually people will put it on our belly or arm. So the sensor itself will measures the interstitial glucose level, which is the glucose found in the fluid between the cells. The sensor tests glucose for every few minutes. However, the sensors must be replaced at specific times, such as every few weeks, depending on the type of sensor that we have.
I will continue with the real-world examples of its use. The first one is blood glucose monitor, and the second one is continuous glucose monitor. So, for the blood glucose monitor, it is typically used multiple times a day, and it is usually used before or after meals, and it is work when requires a small drop of blood. The second one is continuous glucose monitor, which is it automatically tracks glucose level for 24 hours, and it is works on uses a sensor that inserted under the skin, which is not directly from the blood. Additionally, the cost of blood glucose monitor, it is less expensive than continuous glucose monitor, which is they are included sensor, transmitter, and
particularly for those with diabetes, glucose monitors are among the most useful wearable medical equipment. Continuous monitoring is one of its main advantages, enabling users to keep an eye on their blood sugar levels at all times. Faster reaction and maybe the avoidance of major issues result from the early detection of highs or lows made possible by this real-time data. Real-time alerts are another fantastic feature. If blood glucose levels rise dangerously, these gadgets can alert users or even the carriers. Users may share their glucose patterns to loved ones or physicians via remote data sharing, which facilitates improved decision-making and the management of chronic illnesses. Finally, by assisting users in modifying their lifestyle in response to long-term glucose patterns, these devices support preventive and personalized therapy. But there are limitations. Costly, especially for those without insurance, can be discouraging. Besides that, long-term sensor use might cause skin irritation or pain. Additionally, there are concerns to data privacy because digital information is shared. And lastly, some users may become dependent on technology and lose awareness of medical condition.
Future outlook and innovation of glucose tracking. The first outlook is the future of glucose tracking is heading toward fully non-invasive, painless, and also AI integrated solution. The second outlook is researchers are also developing skin patches and tattoo based sensor that measure glucose through sweat and also fluids. AI intelligence, which is AI, may soon play a big role by analyzing a user's glucose trends, sleep, and physical activities. AI also can predict glucose fluctuation before they happen, and also allowing yearly intervention. In the future, I believe that glucose tracking will become a part of a complete metabolic health system, combining data from heart rate, stress level, diet, and glucose into one integrated app. This would not only help people with diabetes but also can prevent it in high-risk individuals.